Um, Welcome and thank you all of you for joining today's webinar. My name is Dr. Sophia Wenzler. I'm a licensed clinical psychologist and the clinical lead here at TrickStop. TrickStop is a therapist-assisted online program that can help you cope with hair pulling disorder. And today we're going to talk about tools for change, a clear guide to habit reversal training, and the comprehensive behavior modification model, in short, ComB. So we're really going to go into the basics of how can you learn to cope and treat hair pulling disorder in the most effective way. I'm going to talk for about 40 minutes, and then at the end, we're going to have a Q&A session where you can ask each and any question that might come up during the webinar or that you brought with you today. I want to just ask you to please not raise your hand. You can write down any question in the Q&A section. Even now, if you have any trouble hearing me or stuff like that, write that down. And in the end, I'm going to get to all of the questions, usually even follow-up questions. Another reason to stick around until the end is that we're going to have a discount code. So in case you decide to sign up for a Trick Stop, we're going to give you a code that can give you a $100 discount on your first subscription. And this webinar is recorded, which means that you can always catch the recording on our YouTube channel. We're going to upload that tomorrow. If you want to send the webinar to someone else, if you want to rewatch it, if there is a certain slide you want to look at, then you can do that on our YouTube channel. Okay. So I'm gonna start by giving just a brief introduction of how I see hair pulling disorder and how it's related to the group of body-focused repetitive behaviors. Then we're going to talk in detail about habit reversal training. I'm going to try to make it as lively and interesting as possible by using case examples, but I really also want you to understand the theory behind this therapeutic approach because it's the most effective that we know of. And then we're going to talk about a little bit of a newer, younger approach, which is called the comprehensive behavior modification model, in short, ComB. We're going to talk about how that is in part similar to HRT and in part adds some aspects and how effective it is. And then I just want to give you a few thoughts of my own as a therapist who has used both of those models extensively on how to approach treatment in the right way, if that's what you're debating. Then we're going to conclude and jump into the Q&A section. All right. So basically, hair pulling disorder is part of a larger group of conditions that are called body-focused repetitive behaviors. That includes also skin picking, nail biting, cheek biting, all kinds of other repetitive actions that can cause damage in the long run. Those behaviors can have many different triggers, from boredom to stress to difficult thoughts and emotions to certain times a day or places. And the behavior is maintained because it provides a brief state of relief or enjoyment or satisfaction in the short run, but then causes problems in the long run. It's not a choice. It's not a kind of self-destructive behavior or self-harm. It's not a failure of willpower. It's more of a brain-based behavior loop. And mostly it's a clinical condition with genetic, environmental, and neurobiological roots that requires evidence-based treatment. So it's not, a habit that you simply need to break. And two ways that I like to look at it in terms of understanding it on a deeper level is, or on a different level, one way to look at it would be self-grooming behavior that got out of hand. So all of those behaviors when they get out of hand and when you, for example, pull to a point where you have bald spots or pick your skin to a point where you get scars, they seem, there's a lot of stigma around it and people feel like it's a weird thing to do, but in its origin, self-grooming is important. It's something we all do. Many people have, pulled out the occasional gray or fuzzy hair or picked at a pimple. Self-grooming is a social, important behavior that we all engage in. We all take care of our skin and our hair. It's just that with BFRBs, it got out of hand because the self-soothing character of the behavior um, got like a new function in our lives, and that's why we started doing it again and again, and it kind of gets out of control. And then at the same time, it's a well-worn trail, right? It's the more you do it, the more well-worn the trail, the neural path that you're creating between the trigger and the behavior um, becomes. And so it becomes a behavior that runs on autopilot, and that's why it's so hard to break. Yeah. So now that we're all on the same page in terms of BFRBs and hair pulling disorder, let's start talking about habit reversal training. So habit reversal training to or knowledge right now is the most well or the best established treatment that we have for hair pulling. There's the biggest body of evidence that shows its effectiveness. And at its core, habit reversal training is kind of a CBT treatment. So that's another abbreviation, I know. CBT stands for cognitive behavioral therapy, which means it's and it's an approach that is evidence-based, which means that everything we do in CBT is based on research, on understanding of how our behavior and our thoughts affect our emotions and our well-being. That's the basic idea of CBT. And habit reversal training is kind of an adaptation that was originally designed for tic disorders. So tics can be like the blinking or verbal tics or sudden movements that you do without really wanting to do them. In its more intense form or severe form, it can become Tourette's. And it was then later on, we understood that it can also help with BFRBs, and it kind of became the gold standard treatment. And that's also why we use habit reversal training here at TrickStop. So basically, when we use habit reversal training, we look at hair pulling through a CBT lens. And what that means is that we try to understand how the different aspects of the condition are related. We always want to understand how our thoughts, our behaviors, our emotions, the triggers are connected. That's why we usually also end up with a cycle when we look at things through the CBT lens, which I like to do. And looking at a behavior as a cycle that maintains itself has three very important benefits. First of all, we see how thoughts, emotions, and behaviors are related. We can understand why a behavior that actually causes damage is maintained. I mean, all of us have asked ourselves, like, why do I keep doing this thing that I know is bad for me, but I still do it all the time, right? That's because there's certain short-term benefits that we have to understand. And then lastly, if we look at behavior or a condition as a cycle, we can also gain understanding of where we can break the cycle. And that's one thing that habit reversal training does really well. So the typical trigger for a BFRB, in this case, This graph uses skin picking, but you could just replace the skin picking with hair pulling. Means that we have a trigger, again, that can be many different things. For example, boredom, that creates the urge, this like tickling sensation or need to pull your hair. Then the actual pulling behavior, a short-term relief, and in the long run, it causes negative emotions such as shame, frustration, guilt. It can cause physical damage such as spots, and it can change the way we see ourselves and the beliefs we hold about ourselves. And habit reversal training relates to this cycle in the sense of that the first step of habit reversal training, first of all, is creating awareness for the cycle. Okay, so in the beginning, we start understanding or triggers. We understand that the pulling behavior is just one part of the cycle, right? We have to also understand our triggers. We have to know what the urge feels like. We have to know why we do this behavior. What does it give us in the short run? And then understand all the long-term consequences. We do that using a technique that's called self-monitoring that I will explain in more detail about shortly. And usually in the process of therapy, the self-monitoring will take up at least 1 or 2 weeks, sometimes much longer, because it's very, very, very important that you create this awareness. It's difficult to work on something that you aren't aware of and that you don't understand. And so awareness basically stands for two things. It stands for bringing the behavior to the surface because oftentimes it happens on autopilot. Oftentimes we're not 100% aware of all of the process. We might catch ourselves in the middle of a pulling episode, or we might only start noticing what's going on when we actually see the hairs that we've already pulled out. And so one aspect is just to be really aware of the whole process, even before the pulling actually happens, to be aware of the urge to catch the urge when it comes up, or to catch our hand when it's already on our way to the scalp or the eyebrows or the lashes. And then the second aspect of awareness training is to understand the greater pattern, to understand how it's all related, to understand what are my most common or most dangerous triggers, what thoughts, emotions, what places, what tools make me engage in the pulling behavior. What do I do after the pulling? What do I do with the hairs? How do I feel afterwards? That is the second important aspect of awareness training. And as I said, like we do that through self-monitoring. During this initial phase of therapy, two things can happen from my experience, not mutually exclusive. It can already have a positive effect because awareness can foster change. So the fact that you catch yourself pulling more often can also lead to you already managing to reduce your symptoms. But it can also have a difficult effect in terms of this kind of awareness can be overwhelming as well. You might catch yourself more often or understand that you're pulling more than you had actually thought. Doesn't like some people even say like, does the awareness training make me pull more? That's usually not the case. It just makes you more aware of episodes or the intensity that maybe otherwise you wouldn't have paid that much attention to. And that can be overwhelming. So it's important to stay in this process until you have a clear idea of your patterns, a good awareness, and until also you've kind of dealt with this level of awareness emotionally. And just to give you an idea of what self-monitoring looks like, this is kind of like a few screenshots of how we do it here at TrickStop. So we have a dedicated tool within the program that helps you self-monitor. If you do it in face-to-face therapy, you might get a protocol like a sheet of paper where you write down basically the same information. So it's like you try to catch every pulling episode, every urge, and then you log. Was it an urge or was it an actual pulling episode? Where was I? When did it happen? How intense was the urge or the pulling? Which body area did I tackle? Which emotions or thoughts did I experience before? How did I feel afterwards? Um, what other triggers can I identify about this pulling episode? And you need to do that repeatedly so you can understand and learn about your very own patterns when it comes to the pulling. In terms of TrickStop, we actually, because it's a tool, we have ways to give you analytics and statistics about your behavior if you log enough. And that's also really easy and good way to share with your therapist, because your therapist will be able to access that data as well and then like help you understand what's going on. Um, and just to like make this a little less dry and theoretical, I came up with this case example um, of Joanna, and we're going to see how Joanna goes through the main elements of habit reversal training and how it affects her pulling symptoms. So Joanna had been struggling with hair pulling since middle school, but the stress of college life made the problem worse. She pulled mostly at night while studying and during moments of anxiety, especially when deadlines approached. So that's basically her background. Now let's see what happens to her when she goes through awareness training. When Joanna began awareness training, she expected it to help immediately. Instead, the opposite seemed true at first. She suddenly noticed herself pulling far more often than she ever realized. During the first week, she found herself thinking, I didn't know I did this so much. Is it getting worse? In reality, she wasn't pulling more. She was simply catching behaviors that used to happen outside of her awareness. For the first time, she was shining a light on those moments. Although frustrating, this new awareness slowly became overpowering. Joanna began recognizing the early stages of her pulling behavior, the moment her hand drifted towards her face, the tingling sensation on her skin, or the way she leaned close to her laptop during late night studying sessions. This awareness created small but important pockets of time where she could interrupt the cycle. Also, she started paying attention to the places, thoughts, emotions, even times of day that seemed to especially trigger urges. So this is a classical example of what's supposed to happen during awareness training. And once we have gained this level of awareness, we can start breaking the cycle. And the two major intervention strategies that habit reversal training includes are called stimulus control and competing response. Stimulus control tries to break the cycle at the very beginning in terms of reducing triggers, and then competing response. Sorry, I'm just distracted by the fact that this diagram, this graph is about skin picking, and the fact that I didn't replace it with hair pulling, but it really that's the only difference. So competing response actually deals with the pulling behavior and tries to help you engage in a more healthier response when you're already triggered to pull. So stimulus control, basically, you can look at it as a prevention strategy. It seeks to change your environment or routines to make the unwanted behavior harder to perform and less likely to occur automatically. And stimulus control techniques can be, for example, blocking access to tools or surfaces that make the behavior easier. For example, keeping your nails trimmed or um, uh, covering the mirror in the bathroom. It can be adding barriers that interrupt the automatic movement, for example, wearing gloves, wearing hats, bandages, glasses if you're pulling your brows, modifying situations where the behavior usually happens, for example, changing the lighting in your bathroom, um, and creating alternative routines at times when urges are strongest. For example, if you feel a strong urge to pull once you're coming home from a busy day at work, then um, adding a 5-minute breathing exercise right after you get home, or taking a shower and washing your hair might be effective stimulus control techniques as well. And stimulus control is especially important when we're talking about automatic pulling, because not only does it make the behavior harder, right? If I wear a hat or a wig, it's harder for me to access my hair, but it also creates a window of awareness. So, for example, if I wear glasses so I can't actively access my brows, obviously, it's not like if I really want to pull, I'm just going to take the glasses off and pull. But the fact that the glasses are there, or that I'm wearing gloves and I notice that once I touch my forehead, means that I will pause for a second. And in that pause, I might have the chance to change my mind and kind of escape this automatic cycle and do something else instead. Competing response, the other strategy, means a purposeful, physically incompatible action you do instead of the unwanted behavior, something that makes it impossible to pull while the urge passes. So it's basically an alternative behavior, and the idea behind it is this idea of the well-worn path in your brain, right? So the path between pulling, trigger urgent pulling is a really well-established neural pathway in your brain. Your brain is just a huge network of connections of pathways, and specifically, if you've been pulling for years, you know this path is a really strong one. And so every time you pull, once you face a trigger or feel the urge, you send a message to your brain, okay, my pulling is what soothes me and calms my nerves. And if you start when you start practicing competing response, you try to connect the trigger to a different behavior to create a new pathway. For example, you use a stress ball, or you sit on your hands, or you use a fidget, or you engage in knitting, or you switch up positions, or whatever it is. But the idea is you create a new pathway which messages your brain, wow, instead of pulling, I squeezed a stress ball and felt calmer. Maybe I don't have to pull every time I feel anxious. And then you have to obviously practice that a lot to create a pathway, a new pathway that can actually compete with the old one. So that's why it's called competing response. Let's see how those strategies help Joanna. So Joanna almost always pulled during long study sessions, especially after 10 p.m., when she felt tired, bored, and anxious about upcoming assignments. She would rest her elbow on her desk, prop her chin on her hand, and unconsciously start touching her hair. Joanna, in terms of stimulus control, rearranged her desk lighting so it was softer and less revealing of tiny skin imperfections. Of tiny again, I'm sorry, tiny imperfections in her hair, or hairs, or what made it harder to find areas where she would like to pull. She placed a smooth stone and a textured fidget ring next to her laptop. She put little stickers with different surfaces on her keyboard. She wore thin cotton gloves on particularly tough nights. And then competing response could look a little bit like this. When Joanna noticed her hand rising to her hair, she first tried clenching her fist for 1 minute. She also used the stress ball and the smooth stone. Keeping both hands on the keyboard, she touched the different stickers she had placed and tried to focus on the different textures of the surface when reading online articles. With these tools, Joanna noticed she could interrupt the urge long enough for it to fade away. Oh, yeah, here I have the version for hair pulling. Yeah, so that's basically how habit reversal training works. You can see in terms of me sometimes confusing the picking and the pulling, that those strategies kind of you adapt them for the picking and you adapt them for the pulling, but at its core, this training works for any body focused repetitive behavior, and it's the same principles. It's stimulus control as prevention, and then competing response as an intervention when you're already triggered. And the comprehensive behavior modification model, ComB, in and of itself is similar. It's also a behavioral approach. It was created later by Charles Mansueto and colleagues. And it basically takes similar techniques, but it adds some, in my opinion, really good aspects and ideas. And I think um, the comprehensive, that comprehensive in the whole abbreviation of COMB really, really describes it best. So in my opinion, the biggest strength of the ComB model is how comprehensively it looks at triggering situations. So it really helps you understand the complexity of triggers by using a model that's called CAMP. And what that means is that in every triggering situation, I look at the sensory, cognitive, affective, motor, and place triggers or place aspects of the situation, and then I find solutions for all of those five different triggers. Okay, what that looks like, I'm going to explain to you in detail because I think this is the most important part of the model. Just another aspect that I really like about the ComB model is like it really breaks down the behavior in terms of like its phases as well. It looks at the preparatory phase, for example, when you're already kind of feeling the urge or already have decided that you want to pull. It includes the searching for gray, curly, or out of place hair, seeking privacy, going to the mirror. Then it relates to the pulling phase as itself, but also to the post BFRB phase, where, for example, you might be disposing hair, touching hair, examining it, even putting it in your mouth, and it kind of includes all of those aspects into the treatment as well. But right now, also in terms of the time that we have, we're gonna focus on this SCAMP model and the idea that every situation can have all of those different triggering aspects to it. And I'm gonna first of all explain what each one of them means. So sensory triggers, there's a lot of them. Basically, BFRBs rely a lot on sensory input. So, for example, the imperfect appearance or texture of hairs can be a sensory trigger in a tactile and in a visual way. Hairs that look or feel as if they are the wrong color, the wrong texture, too long, too thin, too thick, too curly, too straight, or maybe have split ends can in and of themselves be a visual trigger. Hairs that are out of place. Then also the feeling that you get when you remove imperfections. That can be visually, the fact that you kind of clean something up, but also in a tactile or a more physical feeling, like the pleasure when the hair is extracted. It can feel like pleasure, right? It can lead to a certain amount of pleasure to examine the hair and its different part, to hold it in your hand. Again, textile sensory trigger. And even putting it in your mouth or swallowing can lead to a pleasant sensory experience. Then there's cognitive triggers, and that basically means beliefs or thoughts that make it more likely for you to pull in the situation. So any thought that when you're triggered or when you're feeling an urge will make it more likely to actually engage in the pulling behavior. And there's certain thoughts that I see again and again amongst my clients that can have this kind of potential. For example, thoughts that are based on the belief that you are helpless. I've done this my whole life. There's no way I'll ever stop. I tried to stop many times. Why should it work this time, right? If you think that way, you're very likely to engage in the pulling. Minimizing or ignoring the problem. It's not that big of a deal. Everyone has bad habits. I don't need to work on it right now. Or I'll just do this one hair, right? Which is oftentimes what we think in the beginning. Oh, just like this one. And then it becomes more and more. Perfectionistic thinking about your recovery. If I slip even once, that means I failed. So what's the point in even trying? If that's your approach, you're gonna give up very quickly. Or allowing or indulging this kind of feeling like I've had a stressful day, just this one time won't matter, or I deserve it, or I just can't resist the urge right now because like I'm so tired. All of those thoughts will make it more likely for you to pull your hair. Then there are emotional triggers. Pulling your hair can reduce stress. It can have a self-soothing quality. And that's why for many people it becomes a coping strategy when you're dealing with difficult emotions. Common situations where I find my clients are often triggered to pull are fighting with a partner or any kind of conflict, stress due to upcoming events, or stress due to tasks where I just don't know yet how I'm gonna solve this task or approach this task, when we're feeling alone or sad, or this very classic situation when you come back home and you're letting your guard down. In this situation, many times clients might say, well, but I don't get it. Like this is the situation where I'm, calm, where I'm relaxed. There's no emotional triggers there, but it's all about the emotional triggers. It's all about the fact that the whole day you're dealing with all of those emotionally taxing situations with a lot of stress. You might be very self-disciplined. You might fight through the day, feel like you did such a good job, and then all your kind of ability to be self-disciplined, to control your behavior is the battery is so low that then you come home and you have no resources left to resist the urge, right? And the moment you let your guard down, the behavior comes up because all of those emotions and all of the stress that you dealt with throughout the day is still there. The fact that you didn't relate to it doesn't mean that it didn't happen and that your body is not still feeling it. And also in people who have BFRBs, such as hair pulling or skin picking, we see higher levels of impulsivity. So the ability to resist this impulse to self-soothe through pulling might be a little bit lower. It doesn't mean, by the way, obviously, that every person who has hair pulling disorder is more impulsive, but statistically, there's a higher likelihood. Then we have motor triggers, which means kind of paying attention to the behavioral or motor path that your body goes through right before you're pulling. So these behaviors, the way the your a hand might go up to your head, or the way certain situations like resting your arm on the armrest in a car or things like that, those are all precursors to the pulling. And there's certain ones that can be specifically triggering, and it's important to identify those and to change those up to break this path that you usually go when you're pulling. And finally, there's place triggers. And place triggers means everything about your environment that makes it more likely for you to pull. For example, the time of day, whether you have privacy or not, whether you're engaging in a sedentary activity or not. Sedentary activity are those where we just sit, scroll through our phone, or listen to a boring lecture, or watch TV. And features that can facilitate hair pulling, such as bright lights, mirrors, tweezers, needles, and pins. We call those implements. And so the idea in the ComB model, using this SCAMP approach, is to understand all of those aspects and then create a plan that will tackle all of them. Because failing to plan is like planning to fail. I love this sentence. It's very CBT. Um, and then here you see the similarity to habit reversal training, right? So in SCAMP, just like in habit reversal training, you start by self-monitoring. Here we see a classic self-monitoring form that uses the SCAMP model. The trigger situation is a person is in the bathroom getting ready for the day. That's a very common trigger. And then we look at this one situation through all of those different lenses, through the sensory, cognitive, affective, motor, and place lens. So, for example, in terms of the place triggers, in your bathroom, when you close the door, you have privacy. That's a triggering aspect of the situation. Also, in this case, we have bright lights, tweezers, and the person is leaning towards the mirror. Those are all place triggers that make you more likely to pull. Then a sensory trigger in this case, touched and saw prickly eyebrow hairs and lashes. So like a visual trigger of like I saw the prickly eyebrow hairs and I also touched them, which increased the urge to do something about it. A cognitive trigger, I have the thought that that those hairs must go. I need to fix this. I'm alone. Nobody's going to judge me. Emotionally, the person felt frustrated by finding this prickly hair, and then afterwards felt successful in removing the unwanted hair. So there was a positive, effective reaction to the pulling in the short run. And in terms of like noticing what your body does, to noticing those motor pathways, the person noticed that they leaned close to the mirror, that the elbow was bent, and the chin was on the hand close to the eyes, where it's like you're really quick to get to your eyebrows. So this is kind of the motor pathway that this person noticed about those triggering situations in the bathroom. And the idea is to fill out a lot of those self-monitoring forms in the beginning to create awareness, just as in habit reversal training, and then to create an action plan that relates, as I said, to each one of those aspects. I can't get into detail about all of them, but basically, like it's the same strategies. It's stimulus control and competing response. So, for example, if we see as one place trigger, there's bright lights in the mirror, then we try to, use fewer light bulbs or lower wattage light bulbs. If we see that there's a certain way of thinking, a cognitive trigger that makes the pulling more likely, we try to reframe this thought or think a different thought, or put a post-it on the mirror that has an alternative thought that will motivate us to not engage into the pulling. and so on, right? So at this point, we will use stimulus control and competing response strategies to relate to the sensory cognitive affective motor and place aspects of the triggering situation. The ComB model is less about understanding whether it's stimulus control or competing response. It's more about this SCAMP model, but I think it can work just as well. And in terms of the question, does it work? So in comparison to habit reversal training, we have much less evidence when it comes to SCAMP, when it comes to ComB. I don't think that necessarily says that the model doesn't work. There's just less, like, it's not that there's a huge body of research that says it doesn't work. We just don't have a lot of research yet for this specific model. There's one RCT. RCT stands for randomized controlled trial, which is kind of like the gold standard way to evaluate an intervention, but it has a very small sample, and it does show some kind of success. What I do want to say is that this model is very, 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 very well received amongst therapists. We certainly use it here at TrickStop. And another reason why I think it is effective is the fact that it just uses a lot of elements of habit reversal training, and we know that habit reversal training is effective. So if a therapist is schooled in the habit reversal training and in the ComB approach, then that's usually a very, very good sign. Just some afterthoughts that I'm going to try to go through quickly, as I'm already over time, as always. As someone who's used those approaches with a lot of clients. So what both HRT and the ComB model do really well is understand all of those different triggers that might lead to pulling, such as stress, acne. Again, for skin picking, I'm so sorry, I'm gonna be more thorough next time. Maybe having failed to stop in the past several times, pleasure in removing imperfections in terms of coarse hairs, nervous energy while sitting down during sedentary activities, or being very self-disciplined during the day. All of those can be different triggers for the pulling, right? And habit reversal training and the ComB model will give us really, really effective ways to deal with all of those triggers, as we've demonstrated plenty in this presentation. However, sometimes there are also underlying factors that go a little bit deeper, certain personality traits such as perfectionism or impulsivity, certain beliefs or patterns such as unrealistic standards, comorbid conditions, which means having other psychological conditions such as ADHD, depression, or anxiety, or sometimes when pulling just serves a deeper function, and it's hard for a client to let go of the pulling because then they don't get the reward of it anymore. There can be a lot of deeper lying roots to the pulling behavior that sometimes lead to the fact that only habit reversal training or only ComB will not work. And that's why I always say, in those cases, just for example, doing it on your own, reading a self-help book might not be sufficient. That's where you need an experienced therapist that can help you tackle those deeper lying roots as well. That's what usually happens here at TrickStop. Once we've been through the awareness training and we've started introducing stimulus control and competing response techniques, it either can work really well and really quickly, or we run into some roadblocks and we all of a sudden take a few steps back, and then that's usually the cause. And if you have a professional therapist at your side, they will be able to identify those things and work with you on those deeper lying issues as well. That's why a lot of times you just can't, stop with the pulling by yourself. You need a trained therapist who knows how to relate to those other triggers using habit reversal training or ComB or both, but who can also understand the bigger picture. And then also, what I want you to consider is what is progress, right? When we hear, okay, this and that therapeutic approach is the gold standard to treat a certain problem, then we might have an idea of like, okay, I'm going to start therapy, I'm going to invest time. And then with the amount of time and effort I invest, I'm going to improve more and more and more, just like almost like it's a straight line. But that is not true in two aspects. First of all, it's never a straight line. I've never ever experienced that with any problem. It's always an up and down. And that's important to know before, because when you get to those red spots, to when you take 5 steps back after taking 4 steps forward, it can almost feel like you're down to zero, like you're back to the beginning, and it can be very discouraging. So you have to understand this is how it works. And even when you're done with therapy, you can have relapses, right? And then you have to work on it again. And finally, it's not always, even if you take into consideration that there's ups and downs, not everyone gets to 100%. Not everyone will be symptom free. For some people, they will get a significant reduction in symptoms that really impacts their life in a positive way. They're not, but there's always going to be some pulling left, or they're always going to feel the urge, and they're always going to have to cope with this urge, or they might be symptom free for a few months or for a few years and then have a relapse and then have to work on it again. But I really believe that every step forward that you do, every time you invest in finding better ways to cope, you're making progress. So sometimes it's just about doing the next possible step forward and knowing that there is always way to improve, always ways to cope better. But it's not a black and white story. And if you go into it with like a perfectionist, unflexible way of what therapy looks like, then you're setting yourself up for failure. And that goes for any problem, not only for hair pulling. Okay, let's conclude. Habit reversal training is the gold standard for treating BFRBs such as hair pulling because it has the biggest amount of research backing it up. When you do habit reversal training, the first thing is you create awareness, and that helps bring the behavior to your attention and understand underlying patterns. Then you use stimulus control for prevention and competing response to alter your neural pathways, and those are both very effective interventions. ComB basically uses the same behavioral interventions, but it's based on a very comprehensive and helpful trigger definition with the SCAMP model. Both approaches are helpful if you keep underlying factors in mind and have realistic expectations of progress. I'm so sorry for taking up much more than 40 minutes for my presentation, but I find it so important that people who look for treatment have a good idea of what the treatment will look like. And so I really hope that this was helpful for those of you who are debating. I want to remind you once again of our free resources, not only those monthly webinars that you're attending right now, also our online forums and blogs on trickstop.com, and then our social media appearances on Facebook, Instagram, TikTok, etc. You can find the recording of this webinar on our YouTube channel, probably tomorrow already. And if by now you're interested in joining Trickstop, then you can try that out. You will get a $100 discount on your first subscription if you use the promo code webinar 100. Okay, now is the time that if you have any questions, you can ask those questions and write them down in the Q&A section. There's one question already. Are there any more trials or studies I could be involved in? That's such an interesting question. I mean, there's research being done all over the world about BFRBs. So you could like look into that in the internet, depending on where you are. There's research groups in many different countries. Just as like a little tiny, one more little tiny advertisement for Trickstop. We actually do our own research here. We have a peer-reviewed study, which means that we used the data, obviously in an anonymous way, of the clients who go through the program and analyzed whether the program is effective. And then it was submitted to a peer-reviewed paper, and then independent reviewers basically checked whether our data was valid and our process was reliable. And we found that the program was very effective statistically. So and we're going to do more research in the future. So every person participating in Trickstop is basically part of research. But yeah, also like you can look into different work groups in different universities and see if they have any trials going that you could participate in locally or through the internet. And that's a great question or a motivation as well, because like I think those doing research regarding BFRBs are constantly looking for participants who would be open to help and to learn. Any more questions? You can ask whatever you want, as long as it's related to hair pulling. Wow, no questions today. I wonder if that's because I was too confusing or too clear that there's no questions left. Oh, okay, there's a few more. Do you have it? And if so, has it helped? Um, that that's an interesting question, very straightforward. No, I personally don't have hair pulling disorder. We do, however, have therapists that openly talk about uh, having it. One of them is our amazing therapist, Laura Sentner. She also does the Q&A webinars that we have on a bi-monthly basis where you can basically ask her each and any question that comes up. And she talks openly about having trichotillomania herself, and she went through the program. And I'm not sure in which webinar specifically, but I think she also talks about how the program helped her. But that's not my place to, share that story. That's her story. But yeah, but it's not true for me. I don't have hair pulling disorder. I'm just trained in treating it. Okay, next question. I constantly check the mirror. So hard to get away from it. Absolutely. The mirror, by the way, is not only a trigger for hair pulling or skin picking. It can also be a trigger for body dysmorphic disorder because it just can be a trigger for eating disorders because it just confronts you directly. And like then, even when you walk around, by seeing yourself in the camera on a Zoom meeting, seeing yourself in reflective surfaces while you walk on the street. But like the mirror at home is a different kind of trigger because there you also have privacy. So that's why covering your mirror, reducing the lighting in the bathroom, using a timer for how long you give yourself to get ready in the morning can be such game changers in terms of strategies, right? And if it's really hard for you to get away from it, throw it out for a while. I mean, if you're already standing in front of the mirror, then stopping the pulling is much harder. Are there any published works you would recommend reading about the links between ADHD and hair pulling? Um, well, that depends. There's definitely studies, research studies on just technically the overlap. You know, what percentage, how many people who suffer from hair pulling also have ADHD. There definitely is some overlap. There's also some similarities in terms of like how the brain functions. There's imbalances in neurotransmitter functioning in certain areas that are the same for ADHD and hair pulling. In terms of whether there's like a book to read about it, I don't know if I can recommend a specific one. I'm pretty sure we have a webinar on ADHD and hair pulling. So if you go on Trickstop or YouTube channel and put in ADHD and hair pulling, then I think you will find a whole webinar on the topic, and that might be interesting to you. And I also talked about the connection a little bit, I think, in my webinar on compulsions and on the neurobiology of BFRBs. I think I also mentioned ADHD. Will you have a more in-depth webinar in regards to SCAMP? That's a great question. So far, we haven't planned one, but if you have a good idea or if you have a topic that you want us to cover in our webinars, then please write to customer support. You see the website, the email address right here, support@trickstop.com, because we've been doing webinars for such a long time that we've covered so many topics already that like we're constantly looking for ideas that might be interesting and contributing to the community. So if we get your feedback, then please write to us. Like everyone who's participating right now, if you have any topics that you want to learn more about, write to our customer support, and we will definitely take it into account because we're constantly looking for new ideas, and specifically we're constantly trying to understand what do people want to learn about, right? Because it's not always as obvious to us when we're looking at it more from the perspective of the therapist than from the perspective of the participant or client or patient. Excellent webinar, thanks. Well, thank you so much for the compliment. I appreciate it. Last one. I've had a very bad week with pulling. Almost all of my hair that I still have or had. I've tried shaving my head a few times over the past several years, but it hasn't cured me of pulling. How do I get out of those trance sessions when I can't seem to stop? Um, First of all, we also have a dedicated webinar for pulling trances. It's very interesting. It's done by our previous clinical lead, Vladimir. So that's also something you can find on our YouTube channel to learn in depth about that. Yeah, it sounds like your pulling is very severe. I don't think that while shaving your head, basically that can be considered a stimulus control intervention in terms of like if you shave off your hair, you can't be triggered anymore to pull it, but then when it grows back, the trigger just comes right back. So it sounds like this is the only thing you tried. Have you tried out habit reversal training with a trained therapist in your area or here at Trickstop? Because I mean, the idea is to try to, rewire the brain and give yourself understand why you're pulling, understand your trigger, and then understand how you can create new pathways in your brain to create alternative behaviors, right? So basically, I think what I'm saying is that I'm missing a little bit of information here. We do get this question a lot. For example, wow, my pulling is so severe. Is there anything that will ever help me? Or I've been pulling for 40 years already. Is it too late or should I still try? And my answer is always, what do you have to lose? Like, if you haven't tried habit reversal training or the ComB approach, then of course, definitely try it because there's a really high chance it might help you. Um, okay, wait, I'm going to just continue this train of thought and then relate to the next comment. And even if you've tried habit reversal training or another effective approach in the past and it hasn't worked, it doesn't mean that it's not going to work for you right now because things change, you learn and you grow. Maybe with a different therapist, it can help. Maybe when you're in a different stage of life where you're less stressed, or maybe in the meantime, you learn to deal with some anxiety or depression that you have, and then all of a sudden it can work. So, like, really, there's no reason to give up, in my opinion. I know it's like, you also have to be realistic. If you tried several times, maybe it means for you, you can't be symptom free, but I think you can always improve your situation a little bit. And then now the same person said, my therapist had only wanted to control my anorexia first. I can't seem to get the local help I need. Yeah, so sometimes if you have a comorbid, a coexisting disorder, it can be specifically tricky. I just want to mention that this is also a scenario that we see a lot here at Trickstop. So people might have a local therapist for depression or anxiety that they see face to face, but then they notice that this therapist is not trained in treating hair pulling. Um, and they go through the program in addition, just so they can also have tools to deal with the hair pulling. So that might be an option for you. Or if once you have the anorexia sufficiently under control, you might seek out another face-to-face therapist that has experience in BFRBs to tackle that problem. Okay. The last comment, and then I have to wrap this up. Thank you so much for helping us trick folks. That's such a cute way to call it. I love the trick or mania, like the whole BFRB community, by the way. Such a supportive, open, and tolerant community. Anyways, I've been pulling for 66 years. I'm debating about becoming a client because I've been so close to overcoming it and just don't know what to do. I've had cancer and I've not had hair for 3 years. I pull the little stubs because they're rough on my scalp. Oh, well, first of all, I'm so sorry you had to go through cancer, and I really hope that you're in a better place now and that your hair is growing back. And definitely, try it out. Like, our program doesn't work for everyone. Obviously, nothing works for everyone, but you can get the $100 discount. You try it out for a month. During that time, you will see whether it's helpful for you or not, whether you feel like your therapist understands you or not. And I mean, it's worth your recovery to be able to let your hair grow back, specifically after, going through cancer treatment. Yeah. So I hope I'm not sounding like overly positive, but I really do believe in habit reversal training. I do believe that therapy can make an impact and change things, not only when it comes to BFRBs. And I really think that Trickstop can help a lot of people. Otherwise, I wouldn't be working here. Okay. Thank you for all the compliments. Thank you for being here. Thank you for those beautiful and honest questions. I hope you are all dealing well with all the holiday excitement and stress and creating realistic expectations for Christmas and Hanukkah and everything coming up. And thank you for being here, and I hope I'll see you around for the next webinars. Have a great day wherever you are.